Hello everyone and welcome to a new episode on this channel. My name is David Scholl. Today is August 1st, 2025. Today we're going to talk about the situation awareness science behind the visual patient avatar, explain the situation awareness system that it really is, and do a live demo together. Thank you all so much for your support of this channel. As a very short recap, situation awareness is the basis behind all of our decision making. Without good situation awareness, we cannot make good decisions, and without good decisions, we cannot perform good actions. The first step in gaining situation awareness is perceiving the elements around us in our system. We do this predominantly by seeing, but also by hearing, smelling, tasting, feeling. In the second step, we turn these elements into meaning. We comprehend them. And in the third step, we make a short-term projection of what is going to happen in the near future. It is particularly difficult for us to gain situation awareness when our workload is high and we are stressed. We have learned from prior research that analyzed critical incident reporting system cases and malpractice claims that just like in aviation, in anesthesia and intensive care, more than 80% of negative outcomes were in their root cause situation awareness errors. That's why we should all try to do what we can to keep closing the hose in the Swiss cheese and be aware of the problem that situation awareness errors constitute and try to avoid them. The visual patient avatar is a translation of the numerical information into a picture, which we humans can perceive more easily. Now, by showing some of the studies we did with visual patient avatar, I would like to give a quick overview of how it improves the information transfer efficiency through direct information representation and parallel information transfer, and its positive effects on distant vision and peripheral vision. You will find all studies we did with visual patient on visualpatient.org. and also a lot of additional information. In the first study we ever did with the visual patient avatar, we showed conventional number and waveform scenarios and the same scenarios in visual patient avatar to care providers for 3 and 10 seconds. The most important finding was that in 3 seconds of visual patient avatar, the care providers were able to name correctly the status of twice as many vital signs than in conventional. And they did so with higher perceived confidence in the correctness of their diagnosis and with lower perceived workload. We later found out in an eye tracking study that it was caused by parallel information transfer. We can only look at one number per second with a conventional format, then we have to jump to the next with our eyeballs. However, when looking at the avatar, we can perceive information of multiple vital signs at the same time. The reason for this is that the avatar presents the information of multiple vital signs in its form, frequency and color, and it also uses direct information representation, which does not require further decoding in the minds of the participants. In a later high-fidelity simulation study, we also found that the avatar improved situation awareness level 2 because care providers more quickly identified the cause of the underlying emergencies in these simulations. In another eye tracking study where we showed avatar and conventional scenarios in the participants' peripheral field of view, we found that with the avatar, a lot of the parameters of the vital signs the participants were able to recognize with their peripheral vision. Let's actually try this together in this live demo. The avatar here starts to pulsate out over the white line, which means high blood pressure, and here in this later part of the video it will turn purple, which means low saturation. Now if we all look at this star here in the middle of the surgical field and start the demo again, you will see that you will be able to recognize the turning of the avatar into hypertension with your peripheral field of view. And also you will see the avatar become hypoxic only using your peripheral field of view. This is very important because there is research out there that found that we only look for about 5% of the time directly onto the monitor during a case. All the rest of the time the monitor is in our peripheral field of view. In another study, we found that when multiple patients were monitored at the same time, for example as in a central station, then the avatar also enabled care providers to name the status of more vital signs correctly than the conventional number and waveform format. This is also something we can experience together. So in this live demo, the task is to identify one of 9 patients who desaturated. So you will see 9 of these monitors, and take the time for yourself to see how long does it take you to find the one patient that desaturated. 3, 2, 1, go. I will stop it here after 7 seconds. It's patient 7 that desaturated. Now you probably already know what the avatar looks like when it desaturates. Same as I would like when I desaturate. Direct representation of information. Purple, cyanotic. So let's see how long it takes to find the 2 patients now that desaturated. 3, 2, 1, go. I could identify it in about 3 seconds, 2 and 7. Last but not least, distant vision. We did a study where participants had to look at avatar and conventional scenarios from 8 and 16 meters away. And we found that when looking at an avatar, care providers were able to name correctly more of the vital signs than with the numbers. This can also be understood relatively easily. If we peek in, for example, here through a window into an OR, we can see easily the snowflakes around the avatar. However, we would have a hard time reading the number for temperature. This is a drawing off of a picture from a hospital in New York where the avatar is used, and you can see that in this installation that they have there, the avatar shows multiple benefits for peripheral vision and also for distant vision. It cannot be overlooked. The avatar quickly becomes the central situation awareness instrument on our patient monitors. It guides our attention to the numerics. It follows Mika Hensley's aphorism here that in situation awareness oriented interface design, it should be our goal to transmit the goal relevant information to decision makers as quickly as possible and with the least cognitive effort. That's how we engineered it. The visual patient avatar is a situation awareness system because it does more for situation awareness than just making the information easier to perceive. The components of this system are independence from auditory alarms, more sensitive visual thresholds, automatic source selection, and comprehensive visual indicators. The avatar has its own thresholds that can be set slightly more conservative than the acoustical alarms. Thereby, just like the ground proximity warning systems in aviation, it provides a visual reference to the terrain, and only once the airplane is turned toward the terrain or our patient gets closer to the acoustical thresholds will also an acoustical alert sound. The avatar constantly selects the best source available. It will switch between sources if, for example, several pulse sources are available and one is lost. For example, if the arterial line loses the pulse, then it will automatically switch to the pulse information from the SpO2 sensor. And it provides comprehensive visual indicators that will also show us when a measurement is not current, has aged, or is interrupted. In this video we can see the real-time behavior of the visual patient avatar situation awareness system. A high CO2 cloud I immediately see and a low temperature. Then I can go over here and look at the corresponding numbers. And here towards the end of the video we can see that the avatar is showing low blood pressure because its thresholds are set slightly more conservative than the acoustical thresholds. And then shortly it also is shown in the acoustical alarm. It's an early alerting situation awareness system if configured this way. Thank you everyone so much for watching. On today's 734th birthday of Switzerland, we say goodbye to you from the Greater Zurich area. May you always have good situation awareness and keep closing the holes in the Swiss cheese.
Alert! Terrain ahead! Alert! Terrain ahead!